What happens when letrozole in its normal doses of 5 milligram taken from day 2 to day 6 does not work? So let's look at letrozole regimes for ovulation inductions in resistant PCOS, and let's look at the various doses and what success rate research tells us. So what's the first step? Sometimes we would give letrozole 5 milligram for 7 days, 2 days more. Ovulation rate from one study was 69.5%. Cumulative ovulation rate increases to 92.75% if it's followed by a 10-day regimen if needed. So that's again increasing the number of days. Clinical pregnancy rate around 31.88% and live birth rate for 24.63%. Now, if you gave 5 milligram of letrozole for 10 days, then it induces ovulation in 76.8% of cases. Again, remember, this is resistant cases of polycystic ovaries when used as a sequential extension after a 7-day failure. This is superior to 2.5 for 5 days with a shorter time of ovulation. Now, if that doesn't work and the ovaries do not stimulate, then giving 7.5 milligram for 5 days, comparable pregnancy rates to 5 milligram for 10 days in some studies, where in fact you had used additional FSH, it produces more follicles than 5 milligram in 10 days in combined protocols, but again, the risk of overstimulation and getting more follicles. The evidence is limited, but extending it to 10 days may achieve an ovulation rate of 83%. This again is limited, much more limited data. What does this tell us again? This tells us that if you want to stimulate ovaries which are extremely resistant, then either increasing the dose to 5 or 7.5 milligram for 5 to 7 days, or extending the dose by 10 to 10 days may in fact push the ovaries much better, but the risk is of getting more follicles. The other option is adding metformin, especially in cases of resistant PCOS, where adding metformin has been shown to work with clomiphene, and we think it also seems to work with letrozole.